Good afternoon, it's Tiffany, and my little blondie is playing over in her play yard. So if you hear cooing and laughing, that's her. We have also Nick Jr. on in the background. I'm one who always has to have background noise, and I just love the songs and stuff. I don't think either one of us really watch it. I think I watch it more than she does. She's 9 months old, so the colors catch her eye, but other than that, she's not going to follow it. But I think I follow some of the shows more. But anyway, so you're going to hear that in the background. And hopefully, my little blondie's not going to cry. She's looking at me. She thinks I'm talking to her. Maybe if I do a sing-song voice, it'll just entertain her. So I'm going to talk today about your first foster care doctor's appointment. That's one of the first things you need to do when you get a placement. And the reason you want to do this is you want to make sure the child is healthy. You want to make sure there's no bumps, bruises, rashes, or anything like that. You want to know everything that's wrong with her him or her when they come in, and if there's bruises or marks on them, you want that documented. Now, the foster clinic in my county is at one of the children's hospitals. I'm not going to say which one because if you're watching me from Minnesota, it'll be different anyway. But they're usually in the children's hospitals. Of course, you will learn all of this through your training, and if not, your agency or CPS worker can let you know. I've got notes here because I want to make sure I say everything. Let's see. Okay, I said just about everything so far. Okay, our agency required shadowing as part of our training, and the lady that I shadowed with was just wonderful. She had, I think, 8 children. 6 of them were fosters, and I got to go along on one of her many doctor's appointments. Now, hers was I live in a suburb of my city, and we actually have a clinic closer to me, so I went to I'll say the downtown branch with her, which was a lot busier than what my clinic is. So I'm actually pretty lucky, except the only thing is mine doesn't have appointments as often as hers. So I did have to wait a little bit for my appointment. But anyway, so I got to go along with her and kind of see how it worked and see what kind of papers you needed and the cards and all this stuff. So you want to get your first appointment. You want to get the first available appointment, and I already explained why. I think we have to have our appointment scheduled within 72 hours of placement, and I actually thought it was you had to have the appointment that far, but that close. But there's just no way because because our little branch doesn't have appointments every day. Anyway, so when you get there, you're going to be asked for the Medicaid card. Hopefully, your child is already on Medicaid. If not, you'll just all my kids have been on it. So, I've only had 2, so I don't really know. I guess you just find out how to get them on it and you get them on it. But if you want them on Medicaid, that way you don't have to pay for it. It's a benefit that they have. So, you want to take advantage of that. Let's see. So when you're there, they're going to ask for the Medicaid card. They're going to ask for the placement papers, your medical consenter papers. Always have these things with you anyway. I have a copy in my purse and in my diaper bag because you never know when you're going to be out and about and something might happen. You have to have your placement papers and your medical consenter papers for this child they're not going to deny, I'm sure they're not going to deny a child to be seen, but you want this stuff because you are responsible for this child and you want to be able to have a say in that. So they're going to ask for all these papers, and they're going to ask you to sign some other medical consent forms. It's really easy. I was stressing out over it because I was like, oh my goodness, it's going to be a lot of paperwork. Well, it's really not. I guess after you see, okay, first of all, when I worked with Alzheimer's people, we had paperwork galore. So a little bit of paperwork's not going to scare me. So, but anyway, I thought that there was going to be more. It was in and out, and I think that it took us an hour. They say give them an hour, and that doesn't include wait time, but I was in and out of the clinic in an hour. Once you get in there, it's a routine exam. They're going to look over the child, make sure they're reaching their milestones, things like that. And it's, you're, of course, depending on the child you get and the medical issues, the special needs, it'll be different. But with, let's say, a basic care infant, you're going to go in there. They're going to measure their head, measure their length, measure their weight. Check everything just like like you would go when you go to the doctor. My first placement needed some shots, so she got shots, which really royally made her mad. Our second placement had a rash, and so they had to deal with that. But it's wonderful because they'll answer your questions, and you get to know the doctors and the staff, and it's nice. And as you know, I've never had children, so I never had to deal with this. Someone who's had children, it's going to be a walk in the park. But anyway, I just wanted to go over the first foster care appointment and how easy it's been. This has been, so far, like I said, I've only had 2 placements, but this has been a very good experience. I mean, there's more good things than bad. Actually, I haven't had any bad things. Maybe a few sleepless nights. And today's nap wasn't so great, but, other than that, the bags under my eyes are so worth it. So I think my next video will be on getting your foster child on WIC. I guess it's called WIC everywhere. Here in Texas, it's WIC. And then, we'll go from there. Thanks for coming on this journey with me. Bye-bye.